formula feeding, types, prep, positioning, how much, and common problems solved. Welcome to Informed Parent Channel, where we support every parent, every step of the way. If you've chosen to formula feed your baby or are just curious about how it works, you're in the right place. Today we'll cover the different types of formula, how to prepare it safely, the best positions for bottle feeding, how much and how often to feed your baby, and common bottle feeding issues and how to fix them. Part 1. What are the different types of formula? There are several types of infant formula available. Always speak to your midwife, nurse, or doctor before switching. Most common types include cow's milk-based formula. This is the most widely used and suitable for most babies. Goat's milk formula. A gentle alternative, still not suitable for babies with cow's milk allergy. Soy-based formula. Often used for babies who can't digest lactose. Hypoallergenic or partially hydrolyzed formula. For babies with allergies or digestion issues, only use medical advice. Anti-reflux formula. A thicker formula to reduce spit up or reflux. Ask your health professional first. Why always check the expiry date and follow age stage guidelines. Part 2. How to prepare formula safely, where we support you through every step of your parenting journey. Now diving into something every formula feeding parent needs to know: how to prepare formula safely and correctly. Because your baby's health depends on it. Let's get started. Why formula preparation matters. Babies have immature immune systems, so even a small mistake in formula preparation can lead to illness. That's why safe preparation isn't just about convenience, it's about protecting your baby from harmful bacteria and ensuring they get the right nutrition. Step 1. Wash your hands and equipment. Always start by washing your hands thoroughly with soap and warm water. Then make sure all feeding equipment bottles, teats, and lids are clean and sterilized. You can boil them, use a sterilizing solution, or a sterilizer machine. Step 2. Boil fresh water. Boil fresh tap water, even if it's already safe to drink. This kills any bacteria in the water. Let the water cool down to no less than 70 degrees centigrade. That's hot enough to kill bacteria in the formula powder. Never use bottled, distilled, or artificially softened water. Step 3. Add water first, then powder. Pour the correct amount of boiled water into the sterilized bottle first. Then use the scoop provided in the formula tin. Follow the instructions exactly. Adding too much or too little powder can upset your baby's nutrition. Step 4. Stir and cool the bottle. Put the lid on tightly and stir well until all the powder dissolves. Then cool the formula quickly by running the bottle under cold water or placing it in a bowl of cold water. Check the temperature. A few drops on the inside of your wrist should feel warm, not hot. Feeding and storing safely. Use the formula within 2 hours of preparing. If your baby doesn't finish the bottle, throw it away. Don't reheat or reuse it. Never store formula at room temperature. How to store formula powder. Keep the formula tin closed tightly and store it in a cool, dry place, not the fridge. Always check the expiry date and don't use formulas more than 1 month after opening. Every bottle you prepare with care is an act of love and protection. Do not add extra powder to make it stronger. Reheat old formula. Use formula left out for more than 1 hour. I prepare 1 bottle at a time unless advised otherwise by a health professional. Part 3. Best position for bottle feeding. The way you hold your baby during feeding helps prevent choking, wind, and ear infections. Feeding position tips. Hold your baby in a semi-upright position, head higher than the stomach. Keep the bottle at an angle so milk fills the teat. Let your baby pace themselves. This mimics breastfeeding and supports bonding. Switch sides halfway through the feed to support even neck development. Why on-screen tip. Avoid laying your baby flat during a feed. Part 4. How much and how often to feed formula. Feeding amounts and frequency vary depending on your baby's age, weight, and appetite, but here's a general guide. Newborns, 0-2 weeks. Amount, 30-60 ml, 1-2 ounces, per feed. How often? Every 2-3 hours, 8-12 feeds per day. 2 weeks to 2 months. Amount, 75-150 ml, 2.55 ounces, per feed. How often? Every 3-4 hours. 2 to 6 months. Amount, 120-180 ml, 4-6 ounces, per feed. How often? Every 4 hours. Baby might have 5-6 feeds per day. 6 to 12 months. Amount 180-240 ml, 6-8 ounces per feed. How often? 3-5 times per day, depending on solid food intake. Helpful tips. Let your baby's hunger cues guide you, e.g., rooting, sucking hands, fussiness. Avoid overfeeding. Stop when the baby turns away or seems full. Formula-fed babies often feed on a more regular schedule. By 6 months, babies begin eating solids, so formula needs may decrease slightly. Important note: always follow your baby's lead. If your baby seems constantly hungry, struggles to finish feeds, or isn't gaining weight, or if you're unsure about how much to feed, reach out to your healthcare providers. You're never alone on this journey. Some babies may feed more or less. That's okay as long as they're growing well, having wet nappies, and seem content. Part 5. Common bottle feeding problems and how to solve them. Problem 1. Baby refusing bottle. Try a different teat shape or flow speed. Offer when the baby is calm but hungry. Try skin contact first. Problem 2. Gassy or fussy baby. Burp your baby halfway through and after feeding. Keep them upright for 20 minutes after feeding. Problem 3. Vomiting or spitting up. Feed smaller amounts more frequently. Try a slower teat flow. Speak to a nurse if reflux is frequent. Problem 4. Constipation. Offer cool boiled water in small amounts. If over 6 weeks, check with a nurse first. Use formula exactly as directed, never more powder. Problem 5. Too much wind or clicking sounds while feeding. Make sure the teat is full of milk and check for a proper latch on the bottle. Why always reach out to a child health providers if you're concerned. Final thoughts. Feeding your baby is about more than nutrition. It's a time to connect, bond, and build trust. Whether you're using formula, breast milk, or both, what matters most is that your baby is loved, fed, and thriving. Was this helpful? Give it a thumbs up, subscribe for more real-life parenting support, and drop your questions or bottle feeding tips in the comments below. We love hearing from you.